Okay, why don't we get started? Good afternoon and welcome everyone to the Social Media and Adolescent Mental Health webinar presented by the American Academy of Pediatrics, New York State Chapter 1, and the Adolescent and Young Adult Subcommittee. Before we begin, I would just like to introduce myself. My name is Jenna and I work with the Executive Directorship Team of New York State Chapter 1. We ask that everyone please stay muted during this presentation today, and if you have any questions, please add them to the chat, and we will be discussing questions during the last 10 minutes of the session today. Following this webinar, you will all receive an email from me containing the required post-activity CME evaluation form, which must be completed. And next, I would like to introduce our activity directors for today, Erie County Health Commissioner, Dr. Gail Burstein, and Associate Professor of Pediatrics and Director of Adolescent Medicine at Golisano Children's Hospital, Dr. Karen Thielen. So now I would like to pass it off to Dr. Gail Burstein, who will be introducing our speaker for today.
Thank you, Jenna. Welcome everybody. Thanks for joining us this afternoon. I have the pleasure of introducing Dr. Megan Moreno. She serves as a tenured professor and academic division director in the Division of General Pediatrics and Adolescent Medicine, as well as vice chair of academic affairs for the Department of Pediatrics at the University of Wisconsin School of Medicine and Public Health. She brings significant expertise in digital health, currently serving as co-medical director of the American Academy of Pediatrics Center of Excellence, creating a healthy digital ecosystem for children and youth. Her editorial experience includes serving as an associate editor of JAMA Pediatrics, editorial board member for the Journal of Adolescent Health, and reviewer for over 30 journals spanning pediatrics, adolescent health, medical education, digital health, behavioral health, and public health. So I'm going to turn it over to Dr. Moreno, who is going to educate us on social media safety. Thank you.
Thank you so much, Gail, and thanks so much for the invitation to be here. I'm thrilled to be here and sharing this lunchtime with you all. I'm going to share my slides and make sure that I've got it on a setting that looks good to you all. And let's start thinking about social media and adolescent mental health. So what I'm hoping to do in our whirlwind of time together is start with centering us on this topic, how it's important to our patients and families. I'd like to then dig into some of the evidence around mental health and social media, and we'll explore 3 hypotheses and what evidence there is behind them. And then I'd like to turn to thinking about resources and ways you can approach this topic in clinic and introduce the 5 C's of healthy media use, and then end with answering some questions. So without further ado, why are we talking about this topic? Well, as many of us on this call already know, the vast majority of teens, we're talking upwards of 95%, and most adults, we're talking about upwards of 75%, use one or more social media platforms. And what we see in the news is often the doom and gloom, the moral panic, the 4-alarm fire of social media and adolescent health. And the image I included here is meant to be satirical, but it's not that far from what we actually see in some news articles. A lot of this fear-based news media has really impacted teens and families, and we know that parents are very concerned about media use by their kids. And what we hear from youth in our youth advisory boards and what I hear in clinic is that teens are really tired of hearing that they're addicted to their phones and that they need to fix themselves. So as pediatricians, we can play a huge role in this area. We can understand the evidence, we can share that evidence and practical approaches to managing media at home with our families. We can dial down some of that fear and really try to focus on child health and how to keep kids healthy as they navigate their digital world. So with that, let's start to think about the evidence, and I'll share 3 hypotheses to consider. The first is a negative linear relationship, the second is no relationship, and the third is it's complicated. And for each of these hypotheses, I'll share one of the significant studies that has advanced that hypothesis as an example, and I'll also illustrate how that study was represented in the news media. So our first hypothesis is that there is a negative linear relationship between adolescent social media use and their mental health. So this hypothesis advances the idea that the more social media use you have, the worse your mental health will be in this one-to-one relationship. One of the studies that really advanced this hypothesis was by Jean Twenge back in 2018. She examined measures of mental health and measures of social media and technology use over time. And one of the really novel ways she did this is that she combined large data sets. This did mean that there was some variation in measures. So some of the studies measured anxiety, some of them measured depression, and some of them measured happiness. And she flipped those scales to say, the reverse code of happiness is depression and anxiety. So there's a little bit of measurement issue in these data sets, but it gave the researchers an enormous amount of power in terms of sample size to be able to look at the relationship between social media use and adolescent mental health. A direct quote from the results section of that paper is that the happiest adolescents were those who spent a small amount of time on electronic communication. However, in the conclusion, this statement was featured and it was picked up by the media. The statement is listed here: adolescent psychological well-being suddenly decreased after 2012, possibly due to their spending more time on electronic communication. And what we see is that this study got a lot of attention, a lot of news media attention. And one of the news articles that really was eye-catching to many people was this Atlantic article that framed this up as smartphones destroyed a generation, which is really profound language and really sweeping, and was actually an article that was written by Jean Twenge herself. So this is hypothesis one. Let's go to hypothesis two, that there's no relationship between social media and adolescent mental health. And I'll clarify before you start to think, wait a minute, I can dispute that with what I saw in clinic this morning. What this hypothesis is saying is there's no clinically significant causal relationship on populations. So for this hypothesis, we're zooming way out and really thinking about this as a causal relationship on populations. An example and significant study in this area was done by 2017. You're starting to probably pick up on a lot of these big cross-sectional studies were very much in vogue in the 2017 to 2020 era. This study was done by Andrew Przybylski out of Oxford. It's a huge study. It looked at more than 120,000 kids and also did some data merging to get that many people to have data to look at. What they found is that there was no association with mental well-being and moderate use of digital technology, and that there was a reported measurable, albeit small, negative association with people who had high levels of social media. Now, you might be wondering why there is a picture of potatoes on this slide, and that is because one unique thing in this study is they included a lot of other health measures, including a dietary recall. And in the dietary recall, they asked the adolescents how many times a week they ate potatoes. And what they found was the risk for people who ate large numbers of potatoes on their mental health was about the same significance and effect size of the risk of large amounts of social media use in mental health. So the news media that they promoted after this study was the idea that screens might be as bad for mental health as potatoes. So you can see for them, they really leaned into this finding within their study as the narrative they wanted to share from their study. So let's go to hypothesis three. It's complicated. So how might this be complicated? The relationship may not be linear, and the quantity of time, which is what I showed you in the first two hypotheses. It might not be the right, or it might not be the only measurement we should be thinking about when we're thinking about social media and youth mental health. So what do I mean by it's not linear? It might be that it's more of an inverted U shape. So there are studies out there that have shown poor mental health impact with either no use of social media or very high use. And what's really interesting about this curvilinear relationship is there's about a decade of research from the late 90s and early 2000s that focused on internet use and mental health. And back then, the current concern was the more you were on the internet, the worse it would be for your mental health. And that literature really promoted this idea of the inverted U curve. What's also interesting if we think about that is it actually aligns with what both the Gene Twenge and the Andrew Przybylski study were kind of hinting at. So in the Andrew Przybylski study, they said they found no association between mental well-being and moderate use of digital technology, and measurable negative associations for people with high levels of engagement. And then on the Gene Twenge study, she hinted at that happy adolescents were those who spent a small amount of time on electronic communication. So it may be that we need to change some of our thinking about what that relationship looks like, and that it's really the extremes that we should be worried about how adolescents are doing. A second, and I think a second piece of this is that this is what a lot of the big national reports that we've seen in the last year or so have also concluded. So that includes the National Academies of Sciences, Engineering, and Medicine. They did a large consensus-based study in 2023 that was called the Assessment of the Impact on Social Media on the Health and Well-being of Adolescents and Children. What they concluded is that most research is cross-sectional, so we really cannot establish cause and effect. And that in general, most of the studies that found associations found small associations that were unlikely to represent a population level effect. Many of you are also aware of the U.S. Surgeon General's advisory that came out in 2023 on social media and youth mental health. That report also did a nice job doing a really deep dig into the literature, and they concluded that the relationship between social media and youth mental health is complex and potentially bidirectional. So these are some other reports that really get at the nuance and the complexity of this question. Now let's turn to the other way that it can get complicated. And it gets complicated to understand this relationship because so many studies have focused on quantity of use. But it's very likely that quality of use is an extremely important factor in whether or not adolescents have positive or negative experiences online. You can even think about it when we think about hours spent watching television. An hour spent watching Sesame Street is a whole lot different than an hour spent watching reality TV. So this is one study. It's from a while ago, 2013, but it's one of my all-time favorites by Ethan Cross. What he did was an ecological momentary assessment study. This is when you send adolescents little text messages to understand what are you doing in the moment right now. And he asked them, what are you doing on your device? And what's your mood? And so they were able to collect all of these little snippets of data of what was that adolescent doing on social media and what was their mood. And what they found was that adolescents, when they reported that they were engaging in passive use, like endless scrolling or just staring at videos at one after another, that was associated with negative mood. But adolescents who reported active use, like taking a picture, interacting with a friend, creating some content they were going to share, that was not associated with negative outcomes. So that study was one of the first to really get at this idea that we need to better understand the quality factor. And that's not easy to do. It's not easy to design those studies. So where does that leave us now that we've walked through these three hypotheses? I hope I can summarize it to some extent in thinking about the benefits and the downsides of what studies have shown us adolescents experience in their social media use. So we know that some of the benefits for adolescents using social media include social connection. It includes opportunities to learn outside of the classroom, opportunities to create content and share it, opportunities for civic and community engagement, for identity development, finding other people who are like you, and having reinforcement of your identity. If you're not getting that in your offline world, in many cases, social media is a place where you can get that reinforcement of your identity. But there's also significant risk, competition, FOMO, fear of missing out, comparison. Those are all issues for adolescents and come out frequently in the evidence for risks of social media use. There's the risk of problematic use, that the use will become compulsive. There's risk of wasted time or displacement of other activities that are important. There's the risk of stumbling onto disturbing or inaccurate content. There's the risk of negative interactions with other people that can range from bullying to harassment to hate speech. There's the risk that poor behaviors will be reinforced or negative aspects of your identity will be reinforced. And there's the risk of unwanted predation. So in some ways, we can think of social media like a hammer. It's a tool. You can use it to build a house. You can also use it to really hurt other people or hurt yourself. And a lot of what determines that outcome is what you bring to that project or how you know how to use that tool. One other thing I'll point out is that when we think about some of the benefits of social media use, it's always really struck me that all of these benefits really align with developmental tasks that adolescents are supposed to be doing. They're supposed to be building a peer group. They're supposed to be figuring out their identity. And so in some ways, it's not surprising that this tool that allows them to do so many of those things in one place is incredibly compelling to our adolescent patients. I think it's also interesting to think that in the risk category, pretty much all of these risks exist in other aspects of teens' online and offline lives. Competition and FOMO, wow, that can happen on a really competitive soccer team as well as on Instagram. Problematic use can happen with video games as well as social media. Wasted time can happen all the time. Exposure to disturbing content, that can happen on mainstream news media. Interacting with bullies or being harassed, unfortunately, that can happen both online and offline. And so while social media can sometimes augment or speed up some of these risks and processes, they're not unique to social media. So hopefully that means that we as pediatricians, when we provide teens guidance and support, that they'll be able to translate that both in their online and offline challenging situations. So through this evidence review that I presented, I hope to now shift to thinking about a new narrative that we have advanced in our work at the AAP Center of Excellence on Social Media and Youth Mental Health. We have really wanted to go beyond focusing on tech platforms or on trends and really try to bring it back to thinking about youth and youth health. So the framework here is really centered on the child as an individual and understanding that that youth is bringing their own characteristics to their social media use. They're interacting with that platform, the platform design, the content, how the algorithm gives them content. And it's really that interaction that's leading to a positive or negative media experience. But even that experience is within the context of that adolescent's family, their caregiver support, their other media use that might influence what they're seeing. It's also nested within their peer group, their school, their community, and the sport they do or don't get there. And then it's all against this backdrop of social, economic, and climate stresses that adolescents are navigating today. So it can be really challenging to parse out what part of this is really driven by social media and what parts of it are information or interactions that are happening in that space but are really unique to that teen. So with that, I'd like to share a translation of this narrative that we have been using to try to frame communication and conversations with teens about healthy media use. So many of you probably remember back in the day, we had the 2x2 rule, no more than 2 hours a day of media and no media under 2. It was fabulous. It was easy to remember. And unfortunately, it didn't work at all. And parents gave feedback that they felt that it really was judgmental towards them. So with the 2016 AAP media policy, we moved away from that 2 hours a day rule and really moved towards more family media plans. And this 5 Cs, I think, represents the next step in our evolution towards really trying to meet families where they are with their media use. So this 5 Cs, it's not meant to be a checklist. It's not meant to be an add-on that you have to do at a very busy checkup visit. It's meant to be a framework to try to center conversations around the relevant Cs that you have on hand. So I'll briefly introduce each of the Cs and some example questions and some resources you could use if you're centering a discussion on a C in a clinic visit. So the first C is child. It's recognizing that teens use media for many reasons in many ways. Every child is an individual. Some kids use media predominantly for social reasons, some for emotional reasons or to calm down. Some teens describe their media use as very functional. They organize their soccer games. They organize their homework assignments. They organize their Girl Scout outings. For some kids, it's very identity centered in a place where they can explore and find connection around their identity. And for some kids, it's very civic and very community based where they want to connect and learn about things that they're passionate about. So recognizing that not every child's motivation or experience is the same. What's also interesting is that media use just doesn't just vary between individuals. It also varies within an individual as they navigate adolescent development. We see a lot of middle schoolers who are using social media in dramatically different ways than they do once they become high schoolers and once they become college students. So that's another factor we can keep in mind is that media use evolves as that child and as their motivations and experiences evolve. So in thinking about talking to kids about their media use, I think open-ended and more broad is better. It doesn't rely on assumptions about what platform they're using or aren't using or what's popular or what's not. I just love to ask teens, what's your media use like these days? It really opens it up for them to share what's important to them. What, if they want to, they can share more specifics about what they're doing, what they're seeing, who they're hanging out with. And I also like the question of, do you ever worry about any aspects of your media use? Can we talk about it? Can we talk through some of your concerns? This is a question that came up through some work we've done with youth advisory boards when we asked them, what do you wish your pediatrician would ask? And this question really came out of that they often are worried about some part of their media use, but they're not sure who they can talk to about it. And they're worried that if they bring it up, that someone will say, well, then just put away your phone and don't use it. So really those open-ended, what's it like for you? Understanding that individual. A tool or resource that I really love for centering on the child is the family media plan. And the family media plan is meant to have a plan that have certain rules that all family members follow. An example might be a no phones at the dinner table, but it's also meant to have some individualization that meets certain kids where they are. So an example is here, you can as you build a family media plan, there's a space for each family member to have a slot, and they also indicate their age. So the family media plan will give age-based recommendations based on the age of the kids in that family. And then what you can see across the top here is there's lots of different rule categories. And if there is a criticism of the family media plan out there, I think it's that there's just too many options. Look at all these rules. There's priorities, media balance, communicating about media. And so with the updated family plan, the way that it works is families can go in and just select the priorities they want to focus on. And you can see it here, these ones that are gray, and then the ones that have no color indicate ones that the family did not select to work on that time around. So it's getting better all the time. So that's child. Let's talk about the second C, which is content. This C recognizes it's really developmentally appropriate for teens to be curious and to seek out different types of content. And that can lead to both intentional or unintentional exposure to information that's inappropriate, that's false, that's scary. And it's also important to recognize that content is very multimedia these days. It could be visual, it could be video, it could be audio. And the way many social media platforms are built are algorithms, and they can get teens stuck in a content loop. So we used to, in the early days of the internet, think, oh my gosh, how can we prevent kids from ever seeing something bad? And I think we've come to understand that teens are going to see something bad. And so how can we help them process that and help them take steps to prevent that from happening in the future, or know what to do when it happens again? So some of the content questions to ask, again, pretty open-ended. Tell me about some of the media content you've been enjoying lately. And then similarly, a question to check in on concerns. Have you seen any content you'd like to check in on, like content that seemed inaccurate or that made you feel worried or scared? These are questions really meant to open up the teen to talking about what's important to them or what they're worried about. A nice resource for content, and many of you probably are already aware of this resource, is Common Sense Media. This is a website that's been around for over a decade. They have ratings for lots of different digital content. They used to do TV shows and movies. Now they have content ratings on even apps. So I love to send teenage patients there when they're really interested in a new cool app to take a look at it and see what kind of quality and content rating it got. This is also a great tool for families to use if they're picking a family media night and they have kids across different age ranges. And it also can really empower kids to use that site to make their own choices and be part of making decisions about content. All right, the third C is calm. This C acknowledges that it's very common for teens as well as for kids, older kids, to use social media or digital tools as a distraction or to help with emotional regulation. It's also very common for adults to do that. And the other piece I would share is that many teens are, or for those of you who take care of older teens like college students, they are very aware of apps that can help them with calm. And there are some apps out there that have had rigorous randomized controlled trials, not many of them, but one I'll point out is the Calm app. Was the focus of an RCT that had the participants use it for 12 weeks. They only had to use it 10 minutes a day, and they did find improvements in stress, mindfulness, and self-compassion, and the effect size range from moderate to large. So there is something for patients who are interested to using some of these apps for calm. But what I often like to talk to patients about is the idea of a calm toolbox, just having an array of tools available to help them calm down, help them regulate their emotions. And that might include digital tools like media or electronics. Some kids calm down by playing games, by looking at social media, but that there needs to be some offline tools in that toolbox. And that might include music or reading, art, taking walks, being outside, connecting to someone they care about. And everyone's toolbox is going to look a little bit different, but we want them to have a robust set of tools to be able to build their skills. Some questions to ask about calm. I often frame it around the idea of a calm toolbox. So saying to a patient, I know media can be a really useful tool when you're feeling stressed. It's normal to use media as a distraction at times, but I'd like to make sure you have a few options at hand, like a calm toolbox. What other options do you have to calm yourself down that don't involve media? And what ideas would you like to try to add to that calm toolbox? All right, our fourth C is crowd out. This is one of my favorites. We know that there's these really essential aspects of health for teens as well as for older kids and kids of all ages, and that includes physical activity and sleep. And in the literature, these are two health behaviors that have consistently been linked to media being a risk factor for decreasing physical activity and for decreasing sleep quality and quantity. So these are ones I really lean into for visits, is ensuring that media isn't crowding out these really critical health behaviors. So in this area, I really like to understand where teens are and what their goals are for physical activity and for sleep. For sleep, I've learned to avoid assumptions and to avoid too simple of solutions. We know that for some teens, the phone is their alarm, that's their only choice, or they live in a two-parent household and they need to have the phone near them in case the other parent contacts them. And not all teens have private spaces outside their room to use their devices. So I've really enjoyed working with teens to understand what are the options available to them, that if their phone is going to be near them, that we can ensure that they're still getting good quality sleep. We also know that teens are very creative, and for some teens, they can use tech to be a tool to advance their physical activity. I remember during COVID, patients showing me different sites that had exercise videos. Some teens find it really motivating to log exercise days or to log with friends exercise days or to get new ideas for different exercise routines. And even for sleep, I've had patients show me different settings that they've used that are effective. There are a series of sleep podcasts out there that for some patients are extremely effective. Listening to music is another one I hear a lot. And for some teens, ASMR is another option to help them with sleep that involves using technology. Some of the questions that I like in the crowd out category are, let's talk about how to be sure your devices aren't having a negative impact on your sleep. Talk to me about your settings. Talk to me about your device placement. What's your sleep routine? And then checking in on how are you feeling about where your physical activity is these days? Do you feel like your media use is helping or harming those goals? For the crowd out, the family media plan can be another resource to consider. For some teens, they'll put limits around where they can use their devices to try to keep certain spaces device free, or they'll put limits on the amount of time they use or certain times to keep device free. So that's a resource that could be used in that crowd out space as well. And the last C is my personal favorite. It's communication. This C is really built on the decades of research that inform how important it is for parents and kids to talk about health. So we know that parent-child communication is critical across many domains of adolescent health. So many studies on how parent-child communication about sex is associated with increased prevention behavior. So many studies about how parent-child communication about alcohol is associated with delayed initiation and more protective behavioral strategies. And so what we can learn from those studies is that having those discussions early and often is so much better than a single perfectly delivered monologue. And I've found that many parents are looking for that perfect thing they're supposed to say about tech use and delaying that conversation when really it could be an early and often. What really makes communication difficult right now, and where I think you'll start to see more and more research emerge, is that parents are using devices and social media as well and going through their own range of emotions about how much they're using and whether that time is well spent. There's some studies emerging suggesting that parent media use is a really significant contributor to that connection between adolescent social media use and mental health. One study that I've listed here is one that my team did. What we found in a large latent class analysis study is that teens who had positive media behaviors, positive well-being outcomes, one of the main determiners was that they also reported a positive parent-child relationship and that their parents weren't using social media around them very much. And so no matter how much media they were using, they were still doing okay. Another study that specifically examined parent technology use found that parent technology use independently was a predictor of internalizing and externalizing problems for their kids, and that parent technology use was negatively correlated with both self-confidence, self-concept, and social emotional competence for those kids. So this makes this really tricky because we don't want to be walking into rooms and giving parents more things to be guilty about, but we also need to recognize this is a really significant variable in the equation of adolescent social media use and mental health. A couple things that I talk to families about in these communication recommendations are checking in early and often for parents to acknowledge this is something they're working on and potentially struggling with. And we also often will talk to parents about using signpost language, especially when kids are, even starting when kids are younger. So being able to give some explanations about what kind of tech use that parent is doing and why they're making that decision and why they're deciding not to use devices in a moment. So an example would be a parent who has a no phones at the table rule for dinner and goes to answer their phone, letting the family know, it looks like your grandma's calling. I'm worried about her health. I'm going to answer this. Another great example that I've heard from parents is when they're starting to teach their kids to drive and their kids are watching them drive, getting in the car and saying, hey, I'm about to drive. I'm going to set my phone out of reach because I know if that text buzzes, I'm going to feel tempted to reach for it. So I'm putting it somewhere where I can't reach it. Or even parents acknowledging, wow, I got really carried away scrolling through that. I'm going to set an alarm next time. Or what do you do to keep yourself from getting carried away with scrolling? So making those communications part of how you as a family navigate your device use, not every second, but making it part of your practice can help kids understand, oh, this is an okay exception to the rule, but this maybe is something that I want to avoid. We do have some communication tools at the AAP Center. We have some communication cards and activities for kids 10 and younger. We often bring these to conferences like the AAP. So the next time you're at an AAP conference, if we're there, we'd love to give you some of these cards. They give families activities that start to shape ideas about how tech can be used and how to keep yourself safe. And then we also have communication starters for teens. So for parents who really aren't sure how to broach these conversation, there's great prompts and great conversation starters. One of the other things I love on our Center of Excellence website, which I hope you all will Google and look up and maybe even bookmark if it looks useful to you, is that we maintain a question and answer portal. We get questions from pediatricians, we get questions from educators, we get questions from parents, and we've had a handful of questions from youth. And for each question, we go through a set protocol that includes reviewing the literature so that we can provide an evidence-based rather than advice-based answer, and then also including other resources both inside and outside of the AAP. So it's been around long enough. There's a really nice library of answers, and those are things you could also use in your clinic visits of, hey, this question was submitted, or this is a really popular question. All the questions about screen time always get thousands of hits. So that's one, if you're looking for a way to frame up those screen time discussions, there's questions and answers related to that on the portal. So I hope that'll be useful to you as a resource, as well as considering submitting your own question. So we have talked through the 5 C's of healthy media use, which includes child, content, calm, crowd out, and communication. Again, this is a framework, not a checklist. And I hope that you'll find some of the resources at the center useful to you. We have, as I mentioned, submitting a question to the portal, referring your patients to our resources. And if this is a topic you really love, we also have an ambassador program where we provide some training and background and some template slides and some opportunities to go out and share some of these great resources. So this is the acknowledgement slide for the funding of the center. And I'll end that we talked through mental health and social media. We explored 3 hypotheses. And then we talked through the 5 C's of healthy media use and how you can use them in clinic. And at this point, hopefully, you know some good new stuff. And I will stop sharing and we can transition over to questions.
Thank you so much, Dr. Moreno. That was wonderful. It's great to hear how the AAP has taken such a nuanced approach since 2016. We have a couple of questions. The first one is, in the studies referenced, what was their definition of heavy use? And that question came up right at the beginning when you were going through the 3 hypotheses.
Oh, great question. Many studies, they'll vary it. They'll often take the data that they have and break it up by quartiles and call the top quartile heavy use. So different studies, it usually ranges anywhere between 4 to 8 hours is what is considered heavy use. The one thing I'll mention too about those studies is that those are relying on teens to give a cumulative self-reported time spent online. And one of the things I often think about when I read these is, gosh, I don't think I could give you guys a cumulative time I spent online yesterday, never mind today. And so I always take it a little with a grain of salt in the sense that some studies have found that teens that perseverate on their online interactions, like they're really worried that someone didn't respond to them quickly or someone wrote back fine and they're thinking, oh, is that fine or is that like, ugh, fine? Kids who perseverate on that, they will count that as time online. So the kids who are reporting more use, it might be partly that they're just perseverating on the use they have. So that's a little nugget that I think about in some of those older studies about tech use reporting. That was your question plus an additional bonus.
That was helpful. Thank you. And if Adina Geller placed the question, and I'm sorry I don't have people's names. I assume it's Dr. Geller, but I don't want to assume anything. We have another question from Amelia Warshaw. And you may have addressed this after she posted it, but how do you address the fact that music is often linked with social media now that we don't use CD players?
Yes, right. But you know, I'm very enthusiastic about the that records are making a comeback. I think that's good. That's just awesome. And I think that's such a great question, Amelia. And it also makes me think I have lots of patients who read on their Libby app on their book, and I struggle with it. It's just a different form of the same media, but it seems interesting to me. It's you know, do we think reading is less valuable if it's on a Kindle versus a book, or if it's on a Libby app versus a book? So I guess to me, I do think that music is usually something that people are playing from their smartphones or from their devices. In some ways, that does open up the temptation that once you're on that device, you can open other things and play around with other things. At the same time, I also have seen teens who are really savvy and will say, I'm going to turn on my music and I'm going to set a timer for 15 minutes. And then I know that it will stop at that point, which is a little different than, you know, a CD waiting for a CD to run out. So I think like with any type of media for music, reading, anything, just talking about how do you set your boundaries, what's working for you and what's not, and what do you want to try to make things better if it's not working.
Yeah, that's so helpful. I don't know if they also meant the TikTok and all the music people are getting off these little TikTok videos. And they're using TikTok to listen to music, but then they're getting caught in this algorithm that keeps them going. And
yeah, that's interesting. I feel like TikTok is a little bit of a different beast because it's such short form videos that I've definitely seen teens who say, hey, I'm going to sit down and I'm just going to have myself a little TikTok session, but I haven't usually seen them do that when they're in the mood for music, because music is, you know, usually you want the full song. But I think when it comes to TikTok, that's a place where having conversations about, you know, it's a very immersive media. Do you ever sit down and think you're going to use TikTok for 10 minutes and suddenly an hour goes by? I bet many parents could say like, oh yeah, that was me. So I think that is definitely a type of media. Anything with reels, with scrolling, with auto advance, having discussions about how are you setting those boundaries and what's working for you and what do you want to do differently?
And then we have a question about AI. Is the Center for Excellence looking at the interface of social media and the increasing presence of AI?
Oh my gosh. Yes, yes, yes. Such a great question. It feels like where we are with AI is where we were with social media like 16 years ago. Everybody's using it. Nobody knows if it's bad or good. It's the Wild West of AI right now, right? So we are looking at it. I think one of the things that's really challenging is we really ground what we do in evidence, and we're navigating a world where there's almost no evidence. The other place I would say that we're seeing this is we're getting asked a lot about school smartphone policies. Lots of schools are starting these. Many of you may have patients who are in schools that are starting them or they're revisiting them, and there's so few studies out there. So I think this is an area where we're really closely monitoring the literature and also trying to see if there's ways we can partner with folks and get studies going. So if folks are interested in that or have ideas, I'd love to learn more.
And that's all of the questions. We have a thank you, and I have some emails from people who got stuck in clinic and we're sorry to miss it, but I believe we'll be able to put the recording out. Other questions?
Are we allowed to just talk or do we have to type them?
Go ahead.
Hi, Megan. Thank you. Long time no see. So my question for you, this was awesome as always. So appreciated. My question for you, those little rules of thumb are so helpful as a general practitioner, right? So 5210 was great because it was, easy to remember, kind of rolled off the tongue. This C thing is harder. I'll do my best to try to incorporate it, but I could really benefit from recommendations on my 11-year-old doesn't have a smartphone yet, and in my mind, I've got a kind of 13 is when we're going to start that, or, high school or middle school, and no social media until 16. And these are completely nebulous things that I'm just kind of like picking out of things I've read, but do you have thoughts on that? Like, can you speak to what you would tell your patients, what you told your kids? Like, those kinds of things are really helpful.
Oh, that's such a great question. And so good to see you, Carrie. And I am so sorry that it's not simple anymore, right? I mean, I miss those days too. Um, so one of my favorite studies that we've done is we did a study with early adolescents, like preteens, like 10 to 12, and we asked them what's the right age to get a smartphone. And they said, there is no right age. It's milestones and development. And I was like, okay, can I hire all of you right now, even though you're 10? But they gave milestones like, does the kid lose their mittens every winter? Probably going to lose their phone, right? Does the kid get in trouble for harassing kids on the playground? Probably going to use the phone to harass kids. I mean, it was so insightful. And so they really talked a lot about certain milestones. And we turned those milestones into here's kind of a little checklist that families could look at together and say, like, where is my kid? It's not meant to say yes or no, you should do this. But so the AAP actually turned it into this smartphone ready quiz. So you can look up I think it's called the smartphone ready quiz or phone ready quiz. So that's meant to be a tool for conversation, but I don't think there is a magic age. And I think the one thing that I also remember coming out in that study is kids who were younger siblings said, oh my gosh, my family's agonized over when the oldest kid was going to get a phone. And a year later, I got their hand-me-down. So just acknowledging that even kids realize that we're struggling with this and that they're looking for some degree of consistency when it's possible.
Such a great question. And I see Dr. Hargrave's hand is up. Go ahead. She's one
Okay,
of our psychiatrists.
thank you. I'm a pediatrician and child and adolescent psychiatrist. And before I became either, I was a roommate of a woman that is a developmental neurolinguist called Marianne Wolf, who studies the brain science of reading. And there is a difference in how where the brain goes and what it does with information when it's reading digitally than when it is reading hard copy. And there's less of a depth of the summary finding that came through to me is that there's less depth of analysis in kids that get their information digitally than kids that are getting their information from studying with a hard copy book. And there's a recommendation I put in the chat to Reader Come Home, with what and its subtitle is Reading in a Digital Age. And it came out in the last couple of years. The author's Marianne Wolf. So I just
Thank you
thought,
so much. Really appreciate that reference.
Interesting. Yeah, interesting. Thank you. And Dr. Bright, nice to see you. Go ahead.
So I just wanted to ask, well, Megan, first of all, I want to thank you. That was a superb presentation. And I just love the idea of really asking kids what they think are the issues or the benefits, and when to start phones. I thought that was great. So, but my question is there a time, or maybe there's not a time, that are there certain guidelines for when you feel a child is ever getting in trouble and need to have their phone removed for a period from them for a period of time? Like, what are some of the situations that would be appropriate?
Yeah, that's a really great question. I appreciate it, Cynthia. I think that in the early days of the phone, this was considered to be a really common approach, and really like, hey, we're paying for the phone. They get in trouble, we'll take it away. I do feel like that practice has evolved, and there's a recognition that for adolescents, especially older adolescents, there's so much tied to their use of that phone. It's very practical. They might be texting their soccer coach. They might be letting their piano teacher know they're running late. They might be using it for directions. They might be that I think that the recognition that the phone isn't all for fun. And in a lot of our qualitative studies we found from teens, they really do view it as a tool, and it's not all entertainment. They're using it to function in their day-to-day lives. They're using it to look up their grades on their quiz, which are now posted online, not written on their papers. So I think that it makes it as a punishment a little harder to think through as an all or nothing. So that's one piece. The other piece is it's the thing that teens are most scared of. And when we talk to teens about, gee, it sounds like you're having a hard time online, why don't you talk to your parents? The number one thing they say is, I'm worried they'll take my phone away. So I do think there's other ways that if a teen is getting into trouble with their phone, there's other ways to go about that I've seen families role model. They get home from school, their phone goes in a spot and they can't use it till XXX hour. Or they need to do an online class on digital citizenship. There's other ways to make that recognition of trouble meaningful without it being like either you have your phone or you don't. So I'm always looking for how do we walk that line of having people be accountable and responsible, and yet maybe the all or nothing isn't as effective as we would have thought it would be. I hope that's helpful.
Great. Thank you.
Such great questions and great discussion. Anything else? I may not be able to see all the hands that are up.
We do have another hand raised from Ann Reagan.
Okay, Dr. Reagan.
I was just going to add to what you said. Sometimes when we have situations where the kids are not able to not have their phone, especially during driving, and it's not safe, a lot of us would want our teens to have a phone in case something happened on the side of the road. But if we think that it's unsafe, sometimes we've worked with families to say, could we review your browser history together? Would that make you feel comfortable? And things like that, or, not tracking apps. That's a different issue and lack of trust, but rather, would you have a problem if I a couple times a week asked to see your phone to make sure we're being safe, making good choices, and using it in a way that is helpful? So I was just going to add that some families, kids initially might be a little averse to it, but if you explain why and that it's a thing to keep them safe, and I want to make sure I don't want to take your phone. So is this a compromise where I could, be able to look at your phone together? Sometimes that's been a little successful as well.
I love that suggestion. And yeah, I think that's fabulous. And I think that's just like you said, that's trust building. and it's also sharing of content and making it not your phone is a secret device that I'm going to break into, or only your, let's just take a look at this. What I love to see is when I walk into a patient room and a mom and a kid are looking at, Instagram photos from homecoming dresses together. That's good role modeling. They're looking through that together, and it becomes part of the communication and not separate from it. Thanks for that.
We have another comment. Teen phone gives me peace of mind in this era of school violence.
Oh, such a great point, Amy. And I'll just mention, we did just do a study of parents nationally about their views on the school smartphone bans. And the number one reason parents were against it is because of safety in school shootings, which is the reality, I think, is a reflection of the reality of parents' concerns about these bans.
All right, well, we've hit 1 o'clock exactly, perfect timing. Thank you for an outstanding discussion, and thank you to all the participants, and thank you so much, Dr. Moreno. This has been great. We really appreciate it.
Thanks so much for the invitation, and have a great rest of your day, everybody.
Thanks, Megan. Thanks for coming.
Thanks, Jenna.
Bye.
Yeah, you did a great job. Thank you.
Oh, of
Really
course.
did.
Thank you. Just waiting for everyone to go, and then I'll stop the recording.
Did you see how many people